Here we are at noon Pacific time, 1 p.m. in Boulder, Colorado, where Kristen and I are joining you from. So hello, everyone. My name is Hamid Ghanadan. I'm the founder and CEO of Linus, and we are a strategy and innovation and insights firm that's focused on helping leaders in the life science, health, and wellness industries make transformative decisions. And I'm joined here with our president, Kristen Apple.
Hi, everybody. Thanks so much for joining us today.
Yeah, thanks. And we're going to talk to you about this topic that's been at the forefront of a lot of people's minds, and so we're really interested in finding out and going deeper behind what's been going on. So the question that we always hear is, what's the future of health, especially with regards to this pandemic and what's happening. And you see a lot of articles today about describing how healthcare is changing as a result of this pandemic. But what we wanted to know is, how are things happening on a normalized basis and where things are? And so for that reason, we've turned to Gen Z as a population or as a cohort. So who are Gen Zers? Let's actually just put them into context with a snapshot. Different generations have been named as a group because not just because of their age, but also because of their how they see the world and how they act and how they react. What are their beliefs? What are their collective interests? What are their behaviors? And so people who are currently 75 or older are called the silent generations, that are followed by the baby boomers, who are currently between 56 and 74. These were people who were born between 1946 and 1964. And then we have the Gen Xers, the 40 to 55-year-old. And I just want to put a shout out for Gen Xers as being awesome. I'll just leave it there. And then we were followed by the millennials, who are 24 to 39. And these are this was a generation that was born in the early 80s to mid 1990s. And we've heard a lot about millennials and their behavior in the media and how they were the first digital natives and so on. And then we have Gen Z, who are currently between 8 and 23-year-olds. These were people that were born from 1997 to 2012. And so that's who Gen Z is. And they've been, this is the generation, the older aspect of this generation are just coming into the workforce. But what's really interesting is that they actually represent 33% of the global population. And so they're 1/3 of the population. And so it's important for us to know who they are and to know them, because it's important for us to make sure that we understand what their interests are and what their needs are, so that we can develop content and move forward from there. So that's why we focused on the Gen Z population. So let's actually talk a little bit more about what we did and why our interests in this population. Kristen, how did this come about, and what do we do? How do we get information from the Gen Z population or the cohort?
Yeah, sure. So, as strategists and innovators at Linus, we're always thinking about what's next, what's happening in health and wellness, what's going to happen with healthcare delivery. And just before the pandemic, we actually fielded a survey where we spoke with 100 Gen Zers on the street across the country, and then 1,000 of them in an online survey. And what we were hoping to find was, what are their influencers? What are they doing in health? Do they even think about it? And what's going on? So what we'll do today is share those forces. And again, I want everyone to think about this because we think it's quite interesting. And there's a tension here where we did this study right before the pandemic, before the world was effectively changed from a health perspective. So we're looking at these results as baseline. And there's a lot of things that are amplified because of the pandemic, but everything still holds true and constant. And I think can really predict what we're going to see in healthcare in the future.
Thank you for that. And so, this is a nationwide study, like you mentioned, and really just a little bit of maybe upfront information about the Gen Z population, and it's really interesting. So again, like we mentioned, this is the cohort that's just graduating school, that are just starting to move into the workforce. They're becoming our employees. They are our job candidates. They are our patients. They're moving into graduate school. They are, consumers. They spend over $150 billion annually on healthy eating and fitness and skin. And so they have a very unique relationship to their health, which Kristen will talk about in greater detail. They're also one of the most racially diverse group and cohort, and they're very inclusive as a generation. And you might actually, this might resonate with you based on some of the things that you hear in the news today, but they are absolutely, into that broader context of the world. They were born into, like we mentioned, they were born into, they are the social media natives. They were born into a connected, documented lives. So many of them as babies even had their own Facebook page where mom and dad was, posting on their behalf. And so they grew up with an audience, so to speak, and an avatar and a social presence just as much. And it'll be interesting for us to talk about, and we're going to touch on this, is how, as they've become their own adults, how they have modulated and changed that. And so they've become known as the phygital generation. And so this is not, they're not fidgety. They are, they are very interested in the interconnection between the physical and the digital world. And, we'll talk a little bit more about this. But what's also interesting is that they're the loneliest generation. And that's what's an interesting paradox, because they were born into a moment in our history, in our lives, where there's so much interconnectedness, and yet they're feeling lonely. They also have been born into a lot of change and a lot of, really unprecedented amount of global uncertainty. And so this is really what's causing them to act a little bit differently than all the other previous generations. So let's talk a little bit more about them.
Yeah, so, as we think about health and as we think about their generation, and as we think about Gen Z on whole, we'd love for you to introduce, for us to introduce GenWell. And this generation, more than any other generation that's living today, is focused on health and wellness. Again, this is pre-pandemic foundational learning about how Gen Z thinks about their lives and the different forces that are really affecting and driving everything that they do. When we talk about GenWell, what we mean is that, for them, health is really more than a vital sign. It's integrated well-being. It's everything they do, from waking up in the morning to looking at their Fitbit or their Apple Watch, tracking their moods on their phone, giving in to social pressures, having anxiety, talking about their mental health. Every single thing that Gen Z does is really connected to health. We'll talk about the 4 forces that are driving them and bring this more to life. But again, we want you to think of this generation as GenWell. What does it mean as we look across all generations? And if you think about what Hamid just talked about, there's 5 living generations right now, from the silent generation, which are the aging traditionalists. These might be some of our parents who are experiencing a lot of elderly sort of disease onset and sort of trying to live their best life in this moment. We have our baby boomers who are still in denial a little bit that they're aging, but they are having severe chronic disease and declining and maybe ignoring what's happening with the coronavirus and just trying to go out and still live their lives. We have Gen X, who sits at the middle of this. I didn't think we were going to get into a rah Gen X conversation. Don't worry for all of you that are out there, but Hamid did do a cheer. We are as the chief health decision makers. So we're not only, Gen X is not only making decisions about their family, both their kids, but also their aging parents. And we've been called sort of the chief wellness officer, the chief health officer of our family. And really also because of the situation with rising healthcare costs and the ability to sort of disrupt and change the future, Gen X is also at the center of the digital health transformation. We have our millennials who are still kind of in denial about some of the chronic conditions that they're faced with. 8 out of 10 millennials in the United States are on their way to being diagnosed with a chronic condition if they haven't been already. They're looking for that quick fix, that Band-Aid that is going to make something go away right away. But again, they're in a serious situation right now about their health. And you look at all the other generations and you think about Gen Z and you think about what they're doing and how they're living their lives. And really, that's why this is Gen Well and their integrated well-being. So I'd love to share the 4 forces that are really driving the future of health, we believe, and also really impact the way that Gen Z lives. So those 4 forces start with interdependence, and I'll go through each one of these with supporting detail and quotes and some data from our study. But interdependence is that everything is connected to their health, from the way they live their lives to the way they interact with their friends, what they eat. We'll go more into that. And then the second driving force is resilience. And this is really marked by this generation's ability to adapt and to deal with stress and to deal with things that are sort of beyond what any other generation has experienced, from school shootings to global pandemics to climate change that is disrupting the way our health systems are built. This resilience is a force that drives Gen Well as will drive healthcare innovation. The third force is speculative. So this is the truth-seeking generation where they have more information at their fingertips than any other generation. We'll talk more about that. And then finally, haptic, wanting this sort of blended reality, this connection between what's happening in person and then what's happening digitally. So let's start with interdependence. As I talked about, this is this ability to sort of live well from both your mental state to your physical state and integrating wellness into every single thing you do. We met Sydney on the streets in New York City, and she said, when I think of health and wellness, I don't necessarily just think of exercise and working out. I'm thinking of a more holistic definition of health. I make sure I'm meditating, I have healthy thoughts, I'm sweating, I'm being active, and I'm thinking about it all the time. What Sydney said represents many of the Gen Zers that we spoke with across the country and really helps us kind of understand how they view their whole lives. And that 72% describe their state as healthy. When we spoke with other generations, we probably got 1 out of 5 looking at the state of their health as being healthy, but this group is confident. They have more data than ever at their fingertips to really describe their healthcare. And so what are they doing? And so, they've grown up differently than a lot of the other generations where they're learning how to meditate in kindergarten. They have a vice president of health on their student government. And so you have your president, you have your secretary, you have your budget person, but then you also have your chief wellness officer that's in charge of the mental health of the student and making sure that everyone is doing well. So health is really something that's integrated, and it's just part of what they do. It's not just a one-off doctor's visit. It's about prevention, it's about exercising and really living well.
I have a question here, Kristen. I'm wondering, with respect to this, are they, with this relationship to health, is it just relationship to health or is it relationship to healthcare? Are they forming a primary bond with the primary care physician? Is that what we mean, or is it more sort of networked and digitized?
Yeah, I think it's a great question. They certainly don't have that relationship with their HCP, but what's happening is that they do have so much data, and they're thinking about it from the moment they wake up. We were speaking with some of the Gen Z groups sort of during this pandemic to kind of check in on our learnings to make sure what we're still talking about is relevant. And they're still like looking at their sleep, they're thinking about what their mental state is, but it's about data and it's not about that relationship with an expert as of right now.
Thanks.
We've mentioned Fitbit, we've mentioned sort of tracking, and 45% of Gen Z that participated in our study are using wearable devices to monitor their health. So they're, again, checking in on their sleep, they're checking in on their moods, and they're using apps to help them do that. They're also using the features that are built in directly to their digital devices. There are a few brands that are really getting it right in this space. Lots that we could list here, but one specifically is Outdoor Voices. And Outdoor Voices, which is the OV on the top, they've really done a great job of integrating wellness into just being outside and getting out there and doing things. So it's not about Under Armour, which is all about performance and winning and being competitive. But again, it takes this Gen Z attitude of health and wellness and integration. And I'm just sort of embodying that in their brand. We have Dailyo, that is a beautiful way, without words, to do micro journaling. Many of the Gen Z respondents that we spoke with were doing sort of monthly mood charts, sort of using emojis to track their mood. And again, they can get a good snapshot of how they're doing emotionally and physically by just using this micro journaling platform. And then of course, during the pandemic, there's been a lot of sort of in-person experience that have transitioned to digital. Barry's at Home, another big Gen Z brand, has transitioned their Red Room to be part of what your living room is now. And so Gen Z is still being able to socially distantly exercise and be well through different experiences that brands are delivering.
One thing that I wanted to ask about, I've noticed a lot of, if you look at videos, for example, of people in this generation doing a lot of bullet journaling and a lot of, the mood charts that you talked about. And I've seen some beautifully drawn mood charts and tracking that. I guess the question that I have is their connection with data and how much they're seeing the data. Could this be like the dashboard generation also? And are there expectations for anywhere in their lives of having these beautiful dashboards of information being delivered to them in this really usable way going to be sort of the bar for any industry that wants to, serve this cohort?
Certainly, this is one of our most design-focused generations that's living. Everything has to be beautiful. They expect that data is presented to them in a beautiful way, in a simple way, easy for them to understand. And as a brand, to be able to get this right, giving them access to be able to chart, to be able to understand what's going on with either what you do as a brand or what Gen Z wants to do personally is really important.
Thanks.
Our second force that drives Gen Z from a health perspective, as well as life perspective, and what we think will really impact the future of healthcare, is resilience. And again, we talked about what this generation has already had to endure in their short life. And because of this, they've really had to focus on something that they're controlling, and that's physical health as well as mental health. They're stressed. Again, this is pre-pandemic data. 52% say they're constantly stressed. 75% are comfortable about talking to their peers about their mental health. I do want to caution, when we check back in with our Gen Z audience, and they're comfortable with talking about their mental health, but there is still stigma there. So making sure that we're not just assuming that they're going to bring it up with us. We need to ask, are you okay? What's going on? Can we do anything to help you? 72% say that managing their stress and mental health is the most important concern. And as we think about all of the different sort of things that could be going on, anxiety is their number one condition that they represent as something seriously impacting their mental wellness. And even 27% are more likely than any other generation to report that their mental health is fair or not good.
With respect to anxiety and stress, I'm wondering, do we have a sense as to what the driver is? Is it because that they're born into this time where there's so much information and so much availability of information and, quite frankly, not good news? So are they being inundated basically with bad news? Is it actually because like the need to close my rings is providing more anxiety? Or is it just because, that they now possess the language to even articulate how they're feeling? Whereas when I was in school, there was no wellness officer. There was no, toolkit for me to be able to even articulate my emotions or even understand them, let alone articulate them. So which one is it? Or, is it just one? And if so, which one is it, do you think?
Yeah, I think it's a combination of both of those things. But importantly, I think that Gen Z has been given the tools to really talk about mental health. And, you know, this is a quote from Ryan, who we met on the street, who talked a lot about his baseline happiness. He said, you know, I think about my mental health quite a bit. I try to keep my base level happiness. I feel like emotionally, I can react to a lot of different situations, but I need to take a step back, get out of my own head, and sort of focus on what's important to me. We heard so many different Gen Z sort of friends talk about the different cognitive behavioral techniques that they had in their back pocket to use if there was a stressful situation, anxiety. And again, unlike any other generation that's really grown up, they've been given the tools to really understand how to deal with their health. Again, I think this is a gift for this generation, and it's something that we should all even think about. There's some brands that really get it, and Snapchat is one of them. It's essential to Gen Z's life. If Gen Z or somebody Googles, you know, anxiety, or puts in the search bar, you know, lonely, depressed, there's a button that comes up and Snapchat says, I'm here for you, and you can talk to their licensed therapist in the moment. They also give you examples to do the chill pill, or give you examples about what anxiety might look like. Universities are also playing a big role in this to help their students. And BYU last year launched an app called Sanvello that they give access to every single student on campus, on and off campus, to really understand, you know, how they're doing, what their mental health has looked like. So those are just two examples of brands that are really communicating well with Gen Z specifically about this driving force.
Kristen, I'm getting a couple of questions in the Q&A box that I think would be important to address now, because I think it's, you know, as people are listening and they're the same question. Could we talk a little bit more about the cohort and who these people are? I know there was 1,000, you know, first there was 100 that we did the interviews on, and then 1,000 that we followed up on. But, you know, where were they? Who were they? Did we break down any kind of demographics, any kind of race, you know, anything more that you can provide our listeners?
Yeah, sure. So in our qualitative study, we spoke with 100 people across the United States. So we had every region represented. We were in big cities, we were in small cities. And then from a quant perspective, it's nationally representative sample, 1,000 people. And importantly for Gen Z, we talked to the 18 to 23-year-olds. So we talked to the older half of this generation. And that's really it. So again, like nationally representative sample that sort of represents the way the US is made up.
Yeah. And I think it's important also to mention that, you know, while it's tempting to think that we're painting a picture of a stereotype of, you know, that every Gen Zer is the same, because one commenter actually mentioned that they have two Gen Zers at home and they're very different from one another, right? This isn't personality. That's still highly individual. This is sort of the connection between this cohort and society, and how sort of policy and innovation and technology, you know, shape behavior, and then how behavior shapes those two things. Would that be a fair assessment?
Exactly. Yeah. Good. I'm going to talk about our third force, and oh my goodness, this is so important for brands to understand because this generation, they are our truth detectives, and they are investigators by nature. Gen Z is looking for those facts, and they will cancel you fast. So make sure that, you know, what we'll recommend is just being authentic, admitting your mistakes, because you don't want a population of Gen Z to be canceling you. And so what do we mean by that? Everyone says, what is actually cancel culture? And I think Lucy says it really well. We met her in front of a Walgreens, and we're asking her about, you know, if Walgreens was considered a health brand. And she said, you know, I used to think that, and then I saw the vaping things that they were selling, and that was surprising for me. I feel like that's not aligned with their mission. So by just understanding what SKUs you actually have in your store, or what your brand is commenting on Twitter or Snapchat or whatever it might be, just knowing that Gen Z is out there. They're looking to have an authentic relationship with you, but if you're not consistent as a brand, you will or might get canceled. And 52% of Gen Z consumers will transfer your loyalty from one brand to another if your brand quality is not up to par. Again, so just being authentic and realistic about what you can and can't do as a brand will be helpful in developing brand loyalty with this generation. As it relates to healthcare, only 34% of Gen Z is trusting what companies tell them about health. The good news from my perspective on this front is the stat on the left-hand side, and that's 68% are trusting what healthcare professionals are telling them. So from an expert opinion, we do have some room to be able to guide this generation. They are listening to physicians. It doesn't mean that they have a personal physician, but again, once an expert is into the role or into their lives, they will listen to them and trust them. They are trusting their moms and family more than anyone else, and this makes a ton of sense. Hadley said here, I wait to go to the doctor until the last minute. I'm asking my mom or my grandmother for the types of medicine that they would get, the last resort of the doctor. And in that circle of care, it's really sort of this equal relationship between mom, Google, and the peers and friends. So Dr. Google is going to get a call or a search. Their mom's going to get a call or their dad. And then we also are sort of considering our peers and our friends. And then third, last result, and this is results from our Quant study, professional experts will be called in to deal with the situation. And as it relates to having a primary care doc, only about half do. And this generation is transitioning between their childhood pediatrician and then going into the workforce or being on campus and looking for a primary care physician. And many options are leaving them very unsatisfied. They don't find doctors or experts that sort of know who they are or get what they need. And it's a big opportunity in healthcare to be able to deliver the right type of care for this patient and for this consumer. There are a few brands that are getting it right, from Talkspace, which offers sort of a flat fee of being able to talk to anybody, a therapist, whenever you want, to SteadyMD, which is an online platform database of virtual physicians. And you're actually fill out a quiz and you're matched to a physician who meets your needs, who might be paleo just like you or is a marathon runner just like you. And so that you can actually have a relationship with a physician that has similar interests and needs that you do. Also, I want to bring up The Cut as an example of being able to sort of cut through the noise and cut through Gen Z's speculative nature. The Cut is a great brand example of being authentic and provocative and giving advice on a lot of different topics from a female perspective, and one as a brand voice is really authentic and is really popular with Gen Z. Our last force is haptic, and this is where the integration of both physical and digital come into play. And by understanding how Gen Z wants to interact with technology is really important and will shape the future of healthcare as well. And we're starting to see that in the pandemic. But again, if we think about this as the baseline of what they want and desire, again, this information could really help sort of design the next models in healthcare and that will live on for a long time. TikTok is a really good example, although having some difficulty lately in the political conversation. But in terms of a blended conversation about being both in person, so sort of having that physical experience, and then also online. So being able to dance with their friends, put it online, be able to interact with their friends and their former and current students, with professors and teachers. This really blended online, offline experience has been quite popular and with a lot of people, and something that we see as something that will be a trend in blending that offline and online experience. Now, if only Snapchat or Instagram could figure this out, I think that we'll see it as an indicator for the future as well. In terms of shopping, what we wanted to know is, are they buying everything online or are they going into stores? And we found that 61% of Gen Z is shopping at retail stores for purchases regarding their health. Again, pre-pandemic information that will live on post-pandemic, but they are doing both a blend of in-person as well as online, but they definitely want that in-person experience. They might be on their phone looking for reviews when they're in store, but they do want to have that physical experience. So don't shift your entire strategy to online only. Same thing goes with healthcare. And so, they want this blended experience in life, and they're doing it with their friends where they're, using their phones and having conversations in that same sort of experience. They also want to be able to experience healthcare in an alternative way. 50% before the pandemic were accessing healthcare in an alternative way. And what that means is they're having some sort of blended experience, whether that be calling Dispatch Health and having that service arrive to your house, using some sort of teledoc feature that's provided by Kaiser Permanente, or going into a minute clinic at Walgreens. They are really trying to access healthcare in a different way, and that really meets their needs and what they want. This blended experience of using an app to understand how you're doing in your mental health is another great example. I talked about Dailyo earlier, but this quote from Julius really brings that to life by seeing the kinds of observations that he's inputting into the app and tracking what he's doing. He says is very rewarding. So they're using this data, this physical experience blended with the digital to really augment their life, not control their life. Some brands here that you're probably all familiar with. So Amazon Care launched their sort of healthcare system, and they start with virtual, and then you can get an in-person visit if you want as a follow-up. A great Gen Z model of care and how they're thinking about healthcare. One Medical, on the corner, providing that sort of concierge service that many people want, is really relevant for Gen Z. And then, of course, from a retail perspective and eye care perspective, Warby Parker being able to order your glasses online. And then if you want to have that option to go into store as well, to talk to an employee or talk to, or try on your glasses in person to make sure that they're okay. So again, having these blended experiences are things that brands should consider and healthcare systems should consider as you move forward with innovation in the future for health. And specifically as you think about Gen Z. So they have really, really high expectations for us. And I think the question is, are we ready?
So let's talk about that actually. Within these four forces, there are questions that I think all of us should be thinking about and seeing if we're, in the process of where are we in that process as this generation becomes our, as they become our employees, as they become our customers, as they become our patients. On the resilience front, are we equipped to check in on their mental health? Can we normalize that conversation still in a way that's discreet, so because there is sensitivity around that? But Kristen, it almost sounds like that's becoming kind of like a vital sign almost, is for this group, right? To check in and see how they're doing. And then are there facets of your brand that really signal some sort of a broader mental health benefit or even a tangential mental health benefit? The interdependence one's really interesting because they see everything is connected to everything. And so they don't distinguish between their own physical health and the environment, for example. They connect, they make a very discrete and linear connection between climate change and their own physical health and well-being. And so how might we be able to leverage this to connect with them and to make sure that whatever we're selling to them or however we're connecting as employers, as colleagues, as brands, are we being authentic and are we being genuine with what we're doing there? Are you offering a holistic solution? So that making sure that we are taking into we're contextualizing the offering in the same way that they're contextualizing the world. And then on the speculation side, have you provided all the sort of the facts? Are you really super transparent with all the benefits that you offer? But also at the same time, is there an option to connect with experts? Because we do see that they value connection with experts. And then on that connection side, and this is one that I think is really important, what you're talking about, Kristen, is the haptic experience, this blended experience. I read an article about 1.5 years ago that said the millennials destroyed the shopping mall and the Gen Zers are the ones that are going to save it. And so are we able to really develop this? Because so many companies that we've worked with have been racing to catch up with what millennials want, and developing systems that millennials have wanted. And it doesn't sound like the Gen Zers are really on board with what millennials want. And so are we prepared for that? Are we prepared for bringing in the physical and the physical realm as well as the digital realm? Also in the context of the pandemic, we're getting a lot of questions about, field sales, for example, and that relationship building. And is that going to be important, or is it just gone for good? And this gives us a lot of hope and a lot of information that actually that connection, that sort of real terrestrial connection is going to maintain its importance moving forward. So those are just some of the questions that we have for you, is to think about how you may want to prepare for this generation to become part of, a major part of society. So that's essentially the presentation that we have for you, and we would love to actually have a discussion with you. So thank you for joining.